As a developmental pediatrician, what I realized was that so many of the children with autism, when I carefully questioned the parents, had a history of normal pre-language milestones the first year, and then a loss in skills or a leveling off in skills between their first and second birthdays. When they got better, they seemed to spurt. They would go from no words to 20 words, for example. And I felt that the normal development the first year and the pre-language milestones, plus the way they improved over time, suggested that we were dealing with a block pathway for language. Bernie Rimland knew what I was thinking and put me in touch with a scientist who was at Cornell. This is about 10 years ago. And he was working in his lab, and he isolated vitamin A receptors in cells in the hippocampus. And every time you process language, these pathways go through there 3 times. In multiple animal models, if these receptors are blocked, they can't learn or remember. And when I was faced with thinking that this was a blocked pathway for language, I tried to figure out what about cod liver oil, or what about vitamin A? Why would these children have vitamin A problems? It made no sense. They were from nice homes, offered a good diet. So I did research on that, and I figured out there are 2 forms. God gave us a form that's an oil at room temperature, and that's in things like liver, kidney, a little bit in milk fat, and old-fashioned cod liver oil. We've altered that to improve shelf life to a form that's a solid at room temperature for all our low-fat milk products, our multivitamins, and all our formula. So I felt like many children were exposed to the altered form of vitamin A, but not many to the natural form anymore. The first child I treated was a 9-year-old who was nonverbal. I put him on his normal recommended daily requirement of vitamin A, small daily doses of the natural form in cod liver oil, and he was nonverbal. He came back to see me 3 weeks later. I walked in the room, and he was telling his mother, "Leave me alone. I can get up on this table by myself." And after that, I had to change my job to have the freedom to study this. I did a double-blind, placebo-controlled clinical trial. It was a double-blind crossover trial in 40 youngsters with autism, and on 3 instruments, they showed significant improvement with a p-value of less than 0.01.